Hi, Dr. Ratcliffe here. Thanks for joining us. We're grateful and glad you did. Well, today we're going to be discussing when your pain persists. And we're going to go over a few diseases that we see in the clinic that can be difficult to identify initially, but when things don't, when the natural history just doesn't seem to pan out, or if things look suspicious, we're just going to review different parts of the body and identify a few of those diseases, and maybe this will help you and you can seek proper medical care. The first region of the body that we want to concern ourselves with, we're going to work from head down, is our head. If somebody has headache pain, you know, people have headaches all the time, and there's the common headache, there's a migraine headache, there's muscle tension headache, and there's something called cervicogenic headache. The headaches that we typically are more concerned about are headaches that are just different than any other headache they had before. Either the pain is just described as just more intense than they've ever experienced, or something that's unique about a headache. That's something that you would definitely want to check with your doctor. Actually, not later. You'd want to check with your doctor as soon as possible. If it's the same old routine headache, certainly that needs to be evaluated by a physician. But one that concerns most doctors are headaches that there's a unique characteristic about them, and typically it's described as just something that's very different that's associated with the headache, either the pain intensity or there's accompanying symptoms, double vision, ringing in the ears, things of that nature. Next, as we move down our body, neck pain. You know, we do see a lot of neuromuscular skeletal disorders, but one thing about neck pain that we need to always be careful and identify is a condition called nuchal rigidity. And that's when the neck is so stiff, if we bend it forward, we may experience tingling or shocks, electric-like shocks down the arm. That's known as nuchal rigidity, or stiffness of the stiffness in the neck. We commonly see that in multiple sclerosis, as well as things like in spinal meningitis. So there's you'd also have accompanying symptoms with meningitis. There might be a fever, headache, and there's other things, but that's something you definitely want to watch out for, is nuchal rigidity. If when you bend your neck, you really can't, or there's electric-like shocks down both your arms or down the leg, there's tensioning on the spinal cord. Okay, next, moving our way down the body, is our middle back, our thoracic pain, or pain between the shoulder blades. For a long time we didn't think much of this, but of late it's considered a red flag of serious disease. So thoracic pain is not typically normal unless there is an obvious underlying sign of a neuromuscular problem. One of the things that we want to make sure we watch out for is a sense of tearing down the middle back, and that would be things like a dissecting aneurysm in the aortic arch. That would also present with some other things, maybe a murmur in the heart. So it's important that you get just a mid-back pain evaluated in any situation, but there are a few complicating and difficult things that can be tricky for physicians to uncover. Let's now move to our shoulders, and if it's not certainly neuromusculoskeletal, things that we want to watch out for in the shoulder. If it's in the right shoulder, oftentimes the gallbladder will refer pain as it irritates the diaphragm to the back right shoulder blade. And on the left side, certainly we think of any kind of heart attack or ischemic event in the heart refer to the left shoulder blade, even up the front of the neck, sometimes even into the jaw or down the arm. So we don't want to be fooled by that, so it's important to get those things checked out. Now, moving down to our lower back, there's many diseases that can cause problems in the lower back, ranging from the kidneys, whether it's a kidney stone or bladder infection, diverticulosis, to cancer. So it's important to get that, if it's persistent, evaluated by a physician. Thanks for tuning in, and I hope this helps.